Both of my children, I was already a practicing integrative pediatrician. Both of my children received antibiotics when they were under 6 weeks of age. And I knew they were necessary, but I also knew the potential downstream effects. We know that antibiotics, especially if given within the first 6 months of life, can sometimes double the risk of virtually every single allergic disease. Antibiotics given in your infancy can increase the risk of mental health disorders by up to 50% by the time your kids are older or teenagers. And the more rounds of antibiotics, the higher the risk.
Hey everyone. Well, I'm so beyond excited today to welcome Dr. Elisa Song. As I was telling her before, I've been a huge fan of her work for a very long time. So, ladies, moms, listen up. If you do not yet know who she is, you absolutely need to put her as your number one for anything geared around pediatric health and wellness. You are just such a wealth of knowledge, Dr. Elisa.
Oh, thank you
So,
so much.
you're welcome. So, I want to start off with, how did your journey lead you to more of this integrative pediatric direction and stepping out of the conventional space?
I always knew that I wanted to do something more integrative. I didn't know what it was called back then, but even before I started medical school, and I kind of stumbled upon in the late 80s this conference of the American Holistic Medical Association while I was at college. It just drew me. I knew that that was something that I wanted to have in my career. I just didn't know how things would unfold. And so when I did medical school and when I was in residency, it was always with this, God, there's something more to medicine. There's something more to pediatrics than I'm so glad I know the conventional, and I'm so glad I know when it's appropriate. But I'm also so thankful that this integrative route has allowed me to understand some of the root causes that we're not addressing in conventional medicine, and also be able to take the best of the benefits of conventional medicine, but also recognize the unintended negative adverse consequences and be able to restore health. So it's the only way I've practiced, actually.
Oh,
And
wow.
the only way I ever would. When I opened up my practice in 2004, it was as an integrative pediatric functional medicine practice.
I love that because that's not a lot of
Mm-mm.
doctors. They start conventional and then, realize like, oh gosh, we're missing something. And you hit the nail on the head. It's root. What's the root cause? And your new book here, which will weave in, you guys. I haven't read the whole thing, I'll be honest, because it just came out while as we're
Yeah.
recording this last week. So um but it's amazing. I know the work you do is so incredible. And your book is a lot about the microbiome. We love
Mhm.
talking about gut health here. So I'm really excited to talk about it from, for kids and teens and all of that. And we know we're just seeing a ramping up of so much health, so many health issues for kids and teens. And so we're not setting our kids up for success, not because
Mhm.
not for purpose, we just don't have the information. So
That's right. That's
yeah.
right. Yeah. I mean, we're all doing our best as moms,
Right,
right?
exactly.
And some of the information that I share, even from the book, I've had a lot of moms say, "Oh my gosh, I wish I knew this when my kids were babies," or, even pediatricians have come up to me and said, "Gosh, I wish I knew this when I was starting out in practice." And, we can't go back and change any of that. And I don't know that we can completely ever get rid of mom guilt, because that's just the nature of being moms, right?
Right.
Um, but we can still give ourselves a pat on the back that, you know what, now I know. Like, now I know. And even if my child is a teenager or a young adult child, I mean, I've had moms call and say, you know what, even my like 21-year-old, they're making shifts and we're moving in the right direction.
Absolutely. So well said. Yes. And I have to remind myself of that too, because I have those moments where I'm like, oh, I wish I would have known this sooner. And it is what it is. So, well, let's dive in. And can you just share a little bit from your perspective what you are seeing with the state of children's and teens' health today?
Yeah. And it's interesting because we all, as you said, I mean, the different parenting eras, right? Depending on how old our kids are. But really, no matter what age our children are at the moment, the future, unfortunately, is not headed in the right direction for them. We know that around these numbers are old from the CDC, but at least 40% at near 1 in 2 kids nowadays has been diagnosed with a chronic health condition. Now, there are many more kids that I see in my practice that haven't been, quote, diagnosed. They don't have a diagnosis because maybe things aren't, quote, severe enough. And yet we as parents are sort of in this place where this new normal is that kids aren't thriving, that they have sensory issues or behavioral concerns or attention and focus issues, or maybe a little eczema patch here and there, or, maybe some joint pains, headaches here and there. So we know at least 1 in 5 kids has eczema now, and the severity is increasing. 1 in 10 kids has asthma or ADHD. By the time kids are 18, 1 in 2 is going to be diagnosed with a mental health concern. And the mental health crisis was we were already at epidemic proportions before the pandemic, but the pandemic has really just heightened things. And, the number of visits for self-harm in our young kids, even, down to 8 years old, but certainly in our
Wow.
teenagers and our teenage girls. We need to be aware that life is not supporting our children's physical, immune, and mental health in the way that we need it to. And my book is all about really empowering parents and children to know, okay, this is the world we live in. We can't live in a different world. And there are some great things about this world, right?
Yeah.
But we also know that many of the things that we've created around ourselves as modern conveniences are causing harm. So how do we mitigate that harm, and how do we thrive even in the face of all of these modern things, that are really
Yeah.
going against us?
Okay, there's so much stuff to unpack here. So, and I know because your book is so much about the microbiome, maybe we kind of go that direction first. Like, what are we seeing with kids and teens'
Mm.
gut health? Which, when we talk about root cause, like the gut has to be a big part of that picture for sure.
100%. And that's why the little blue burst on the book says why your child's microbiome holds the key to lifelong wellness. This is so true for adults, and it is
Mhm.
even more true for children because, as some of your listeners know, our 80 to 90% of our immune system lies in our gut. And so when our children's gut immune systems are rapidly developing from the moment they're born through, even their early 20s beyond, we know that the gut microbiome is shaping, influencing how their immune system is developing, whether or not they have a resilient immune system, or maybe are going to be one of those many kids that tips over into eczema or asthma, or unfortunately autoimmunity, later
Mhm.
on. Our teenagers are the age group with the most rapid rise in rates of autoimmunity of any age group. And so that can seem a little daunting, but then at the same time, we know, well, we understand how to optimize gut microbiome. So we have this opportunity to shape our children's immune health. Same thing with their mental health. We know that children's brains rapidly develop. You could see the wheels turning as a toddler, right? Like every day you're like, this kid is different. And they literally are. Their brains are different. That same thing is happening with your tweens and teens, this explosion of brain synapses, these connections. And what's driving that is your child's and your teen and tweens gut microbiome. We know that at least 80% of all the serotonin in our body is made by your gut bugs. If you have the right gut bugs, right? If you have the right microbiota, 50% of all the dopamine, which is implicated in attention, reward, motivation, ADHD symptoms, 50% is made by our gut microbiome. Again, if we have an optimal gut microbiome. So the ripple effects of optimizing your child's microbiome on their immune system, brain, um, behaviors, metabolic systems, hormones later on is huge.
Oh, absolutely. It is the root. And I feel like so many times we can end up chasing around symptoms and kind of barking up the wrong tree when we are missing looking at the gut. Absolutely.
Yeah.
So we have to talk about antibiotics because I feel like this is a big part. The antibiotic conversation
Yep.
is a big piece. What knocks down our microbiome at such a young age. I was a classic case of that on so
Mhm.
many antibiotics when I was younger. And I've spent, fortunately, I was sent down more of that holistic path at a younger age. At some point I figured this out, like what's going on. But not everybody has that luxury to
Yeah.
figure it out quite so soon. But I look
Yep.
back and I had all this stuff going on and I was on a lot of antibiotics at a young age. And we know that just knocks down our microbiome. But
Yeah.
sometimes, and as a parent, right? There's a time and a place sometimes where you really
That's right.
need it. But we have to like, can you talk about this? Like, what is the, I think we all know like that antibiotics, like how they can be bad, right? They're knocking down our good and bad stuff in our
Yep. Yep.
microbiome. But why is that so problematic? Like, how long does it take to build our microbiome
Mm.
back up? What are all the other effects? Let's dive into this a little bit because I
Yeah.
think this is such a big part of the conversation.
It's such a huge part of the conversation, and it's so important that I have one entire chapter that's called "What Every Parent and Practitioner Should Know About Antibiotics." Because we really need to understand, as you said, they can be life-saving. And I tell every mama listening that both of my children, and this is me, I was already a practicing integrative pediatrician. Both of my children received antibiotics when they were under 6 weeks of age.
Mm.
And I knew they were necessary, but I also knew the potential downstream effects. So did I not want to? Of course, but I knew they were necessary. And as you said, I did have the luxury to know how to mop up the gut microbiome afterwards. And we know from large studies. And I'm going to pause and just have everyone just take a breath here because this is another thing you only knew what you knew at the time.
Yeah.
But we know that antibiotics, especially if given within the first 6 months of life, can sometimes double the risk of virtually every single allergic disease, like asthma, eczema, hay fever, even anaphylactic food allergies, which we know are on the rise. All of these. Antibiotics given in your infancy, especially in that first 6 months of life, but at any time in childhood, can increase the risk of mental health disorders by up to 50% by the time your kids are older or teenagers. And the more rounds of antibiotics, the higher the risk. We know this in adults too. We know this, that the more rounds a teenager or an adult has of antibiotics, the higher the risk of developing a mental health concern. And why this isn't shouted out, given our crisis of mental health, I'm not quite sure this information has to get out there. I think that many physicians are not aware of the ramifications. And we are in a different time where, I mean, when I was a kid, my mom was an OBGYN. I mean, I had antibiotics for every cold virus, which we know antibiotics don't do anything for colds, right? But they were kind of given out like candy because, oh, what harm could it do? Now we're on the other end where we understand from a public health perspective, antibiotic resistance is set to be a leading cause of death worldwide by 2050. I mean, unless we
Wow.
really understand how to use antibiotics appropriately, judiciously, which I talk about in the book. But that's on a public health level. On an individual level, because as a mom, we're worried about this one child in front of us, right? On that individual level, we also know, as you said, that antibiotics will wipe out the good bacteria right along with the bad bacteria, sometimes preserving the bad bacteria, which is why we often will see C. diff bacterial infections after antibiotics, which can be really problematic. But in wiping out the good microbes, if we don't understand how to restore microbiome resilience, that's when we have the downstream effects, potential increased risks of later metabolic concerns like type 2 diabetes, which is certainly on the rise in kids, hormonal imbalances in our teens and tweens, mental health concerns, and immune problems. So knowing that, and I also want to say here, it is never too late to restore your child's microbiome, right? I mean, we can
Yeah.
always figure that out. It might take a little longer. I mean, if your child's antibiotics were years in the past and now they're having some immune issues or some mental health concerns, we can still get there. It might take a little bit longer, but we can still get there. And maybe your kids are currently on antibiotics, let's say a teenager on low dose antibiotics to control their acne. Well, I'm not saying stop that if it's helping them, but we can still continue to restore their microbiome even when they're on these medications.
Yeah.
So, how long does it take? I mean, without any intervention, it can take several months, sometimes years, for some of the beneficial bacteria to come back and call your child's gut and your gut too. I mean, how many adults are still on multiple rounds of antibiotics? To create a healthier microbiome, a healthier ecosystem. But when we know how to lay down those foundations of a healthier ecosystem and, create an environment in your gut where the friendly bugs want to come back, that is the key. It's not just about throwing tons of probiotic supplements into your gut. We want to create an environment, a little ecosystem where the good gut bugs, the probiotics say, hey, I kind of like that place down there. I want to make it my home. And I want to bring all my friendly, good neighbors here to make their home while keeping out kind of the seedy neighbors, right?
Right.
And so that is when we think about it, that's the foundation, and that is the foundation for creating a resilient microbiome for life too. And that's exactly why I talk about these 5 things that create microbiome magic. But just in terms of the micro antibiotic restoration, because a lot of parents who are listening do have kids who have had multiple rounds of antibiotics, or do have kids with chronic health concerns. I have a whole um, post antibiotic microbiome repair
Mhm.
protocol that I use for my patients. And ideally, you would start that alongside your antibiotic course. So you do that while you're taking the antibiotics. That includes returning to these 5 things for microbiome magic that I just talked about. But then also this is the time where we may need to go beyond food as medicine and use some supplements to keep the gut lining really healthy, prevent something called leaky gut with things like additional zinc supplementation, glutamine amino acid supplementation, fish oil supplements. And we want to be mindful of preventing any overgrowth of abnormal bugs like yeast that many women know, right? I mean, we know you get an antibiotic and oh my gosh, there's a vaginal yeast infection or there's whatever it is,
Yeah.
or the rash on the tongue. I mean, you name it. So that would be, really also um, focusing on getting the right strains of probiotics in to restore your gut microbiome.
And I'm assuming you have it all written out exactly which strains. It's probably
It's
too deep of a conversation. That's why it's in
Yeah,
the book.
yeah. So, one of the things that really we want to understand when taking a probiotic supplement is it's not just as simple. I used to say, you know what, just pick the one that has the most strains in there. Get a lot of them, a lot of colonies, right? But it's interesting because more isn't always better. There is some evidence that if you're throwing like trillions and trillions of probiotics into supplements into your gut, it can actually sometimes prevent some of your own beneficial flora from wanting to come out. It kind of crowds them out, right? And so we want to think, okay, what are we using the probiotics for? In this case, we're using it to restore the microbiome after antibiotics. And there are several strains that have been studied to and shown to be able to do that. On the other hand, if you're working on your child's mental health, we may need those strains because their microbiome has been disrupted by past antibiotics. But we also want to focus on strains that have been studied to optimize serotonin and dopamine levels. So, I mean, there are these scientific names that, would be hard to, really write down if you're listening to this, but it is all in my book. I list the specific strains to look for. And I have a resource guide too, because one of the questions I get from parents is, well, I mean, you don't want to trust that, buying supplements at your local health food store or Amazon if you're not sure about the brand or the source that it's shipping from. So I do have a resource guide in the back of trusted brands, practitioner brands, even consumer facing brands, and even suggested dosages, because that's the next question. I mean, kids
Yeah.
run, we have little kids and big kids, right, and
Right.
teenagers. And of course, the dosage for a 2-year-old is not going to be the same as for your 12-year-old. So I also have suggested dosages for that.
Yeah. I appreciate all of the work that you've done. And I also want to say, I appreciate hearing you say it's not always more is not always better when it comes to
Hmm.
probiotics. I've noticed that with myself and with clients that I work with, that sometimes we have to think about like sneaking in new probiotics and slowly working them
Hmm. Yep.
so that they essentially take into our microbiome. Because otherwise, and please add to this, but I feel like if you add a big dose of probiotics, I mean, and then you have all these symptoms, bloating and just you feel icky, like that's a good sign that you've probably overdone it and you should pull it back. Or if your kids say that. So it's like you got to listen to
Yeah.
your body
Yeah.
too, and your kids and have communicate with them depending on their age, of course.
Yeah.
But yeah.
Absolutely. And then, when I talk to parents and kids about probiotic supplements, because oftentimes there's this idea that, well, the probiotic supplements and even the other supplements are going to be enough. And they may be temporarily, but I have kids think about probiotic supplements like Jack's Magic Beans. You can't just throw, a ton of probiotic supplements into your gut microbiome without creating that ecosystem we were just talking about and expect those probiotics to want to stay. They're not going to. They're going to pass right through. And so if we create that foundation, create a great home for these probiotics with the food we're eating and the lifestyle we're living, they're going to say, you know what? I actually want this person to be my host. I
Right.
want to stay here and do all the things that I know keep my host healthy and happy so that they can be, so that they can thrive and I can thrive. So it becomes this symbiotic, mutually beneficial relationship. But really and truly, it's our microbiome that gives us way more benefits than we
Mhm.
give to them. And so we have to have a healthy respect for these microbes that have chosen us to be their host and
Right.
take care of us. Or if we're doing things maybe in not the most gut friendly way, we might be calling some microbes, they might be calling us their home that we don't really want in us. So we just have to think about it that way.
Yeah, the ecosystem. And I think I love putting it that way. It's like that terrain, that ecosystem of your body is so, so important. I always like to give the example. You can take two people that technically, like their labs could look exactly the same. They could technically have like the exact same like things going on in their body, but one person can exude a ton of symptoms and one person may
Yeah.
not. And
Yeah.
it's all comes down to microbiome and their
Yeah.
ecosystem. So you are
Absolutely.
just going to be so much more resilient to whatever life throws at you when we have a better built microbiome. Okay, so I have a couple more questions that
Yeah.
direction, but I want to ask you something about antibiotics because I know parents are thinking, okay, so are there other things that we could give our kids in place of antibiotics? I know that can be
Oh,
a loaded question because
yeah.
it depends on what's going on, but are there
Yeah.
some
Yeah.
key examples that you might have that are like, these are common things we see in kids where we
Yeah.
might generally give an antibiotic? Are there other options?
Yeah. I love that question. Thank you for bringing it up because that's actually the entire part 4 of my book, right? Because, as an integrated pediatrician, I teach parents and I teach kids how to use um, essential oils, herbal medicines, supplements, homeopathic medicines, acupressure points for when they're sick with just about anything, whether it's fever or earache or tummy bugs or colds and flus and sore throats. I mean, you name it. And a really important thing also, as an integrated pediatrician, I also want parents and kids to know, well, when is it time to go to the ER or see the doctor,
Yes.
right? When is it appropriate to consider antibiotics? So I put all of that in part 4 because I don't want you as a mom. Of course, it's always the middle of the night, right? When our kids get
Right,
sick.
right.
So I don't want you in the middle of the night, with your child with a sore throat flipping through the book. I want that to be your bedside reference, but then being left high and dry and like, okay, but am I really doing the right thing? Should I have called my doctor? Like, do I need antibiotics? So it's all in there. And the reason I put that in there is really because there's so many instances where when we start our natural treatments right away, we can get your kids well and really avoid many of those antibiotic prescriptions that might be necessary if we didn't do anything, right?
Right.
Um, and so I'll give some examples. I mean, where antibiotics might be needed. I would say earaches. I mean, earaches are the number one reason for a visit to the doctor's office, and really the most common reason for antibiotic prescriptions. Now we know that most ear infections, even if they're bacterial, are going to resolve on their own. And the American Academy of Pediatrics, their guidelines for I mean, almost 2 decades now, has been a 72-hour watchful waiting period for almost all kids, right? That means
Yeah.
you go in, oh, wow, your ear looks really red. But you know what? There is an option to wait and watch and see if your kid's going to get better for at least 3 days, right? If they get worse, then we can always start the antibiotics then. But a lot of moms aren't told that as an option, unfortunately. It's still not part of the main, clinical experience
Right.
for a lot, right? So,
So
and
two,
then Mhm.
Dr. Lisa, I want to just ask you really quick with the ears, because that is a common thing, something that
Yes.
I grew up, lots of ear issues, ear infections, all of that. So what, two things. I mean, I know if it's an inner ear, right, that's generally if someone's going to need an antibiotic because it's in the inner ear. But what if it's more of that middle or outer or middle ear? What about the garlic drops? Are you a fan of doing like the essential oil or
Yeah, yeah.
the garlic
So
drops, things
there's
like that?
there's two different kinds of ear infections. What most people call the inner ear infection is a middle ear infection. So it's
Oh, okay.
behind the eardrum where typically you get a cold congestion fluid. That fluid gets a little stagnant. Sometimes bacteria or yeast or whatever can overgrow, cause the pain, right? And sometimes the fever. And that is where sometimes there is bacteria involved. But even then, that middle ear infection may resolve without antibiotics. There's also the outer ear infection, which is also called swimmer's ear. And that's more on the outside where you get kind of gunky, like just whitish, kind of yucky material building up. It can be very painful too, just painful as you're kind of tugging your ear, can really hurt. Both of those, the garlic ear drops work amazingly well,
Mhm.
even for that middle ear infection where we're suspecting there might be some bacteria and virus in the mix. Now, why is that? Because inside that fluid, often there's a mix of organisms. Garlic is an amazing antimicrobial, kills bacteria, yeast, and viruses, and can penetrate the eardrum and get in and relieve pain and kill the infection. So that is absolutely one of my go-tos. And even in the literature, there's some um, good studies showing, and I put the studies in there if you want to know, but there's good studies showing that it can be really effective and can reduce the need for antibiotics, even homeopathic medicines. There's one homeopathic medicine called ferrum phosphoricum that I list in there, and an herbal medicine called you can buy easily over the counter. It's called Umka, UMCKA, Umka cold care syrup. That is has a one particular herb that has been found to have amazing antiviral properties against common cold viruses like adenovirus, rhinovirus, coronavirus, RSV that was going rampant last year, influenza viruses, the hand, foot, and mouth virus, and even some bacteria. So there's so many things we can do.
Yeah.
And then okay, if it's not helping after a few days, that might be the time for antibiotics. But now at least you know it's really necessary, and you know how to mop up the unintended side effects and restore your child's microbiome.
Right. Absolutely. Yeah, I've had a great success, you guys, with the garlic eardrops. I
Mhm.
wish I would have had those when my kids were even younger. I didn't find out about those. I don't remember. We've used them for years now. And I can't tell you, if you get it right away,
Yes.
that's the key, I think, with everything is like you just gotta try to catch stuff as soon as possible. And then it
Yeah.
can
I mean,
knock
I
stuff out
love
a
that
lot
you said
faster.
that because it is a paradigm shift. Because when you have a cold, what happens if you call your doctor? Well, I guess maybe try some Benadryl or Sudafed, even though no studies have shown that those work. Right. And just, if it's still there after a week, then call me back because maybe it's a sinus infection. Maybe you need antibiotics. Well, so now we're trained as moms to just wait it out. because there's not much you can do in conventional medicine. With natural medicines, you want to jump on it, right? The sooner you can start to really help your child's immune system just, get a boost, a leg up, and fight whatever's going on, the faster it'll recover. So it's just a different way of thinking.
Yeah, absolutely. Got to be, and then preventative stuff. And I'm sure you talk all about that. So many good things. So many good things. Is there anything else we haven't talked about with antibiotics in particular that you really like to share? Make sure you share with
I
parents.
do have in the book 6 questions to ask the prescribing
Mhm.
doctor before you start antibiotics. The
Okay, great.
number one question, I mean, we won't go through all 6, but the number one question is simply just pausing and asking the doctor, "Hey doc, is this antibiotic really necessary?" Right, it's not in an adversarial way. You're not saying, "I'm not gonna do it." You're just saying, "I just wanna know, is it necessary?" And why is that important? Because, we all know that there are some mamas and papas who, caretakers who go to the ER and with the sole mission of leaving with an antibiotic prescription, right? I
Mhm.
know you guys aren't like that, right? But there are. And so, doctors are much more likely to prescribe an antibiotic if they think you want a prescription. So simply pausing and saying, "You know what? I want to do it if it's necessary, but is it really necessary?" Lets that doctor know, "Oh, okay, this is a mom who wants to be a little bit more thoughtful, a little bit more judicious," opens up the conversation of, "Yeah, we could wait and see. We could wait and watch for a few days, and here's a prescription just in case.
Mhm.
And then in the meantime, you can do all your natural things and hopefully nip it in the bud."
Yeah, that's amazing. The all the natural things we have out there and boosting up your microbiome, what it does to your immune system, your kid's immune system. It's fascinating.
Yeah.
Okay, Dr. Lisa, I want to turn our conversation back a little bit more when we were talking about microbiome and more the mental health side of things and how that is so interconnected, and specifically the vagus nerve. I know I'm hitting on some of the big
Yeah.
things, and I'm so glad you're talking about these things because these are some of like the most important things. And I see this with my clients. I'm like, we can eat all the right foods, do
Mhm.
all the right things, essentially be taking and doing and feeding our microbiome all the right things, like to a T. But if we are not working on our nervous system, doing that
Yeah.
stimulation, then it really is kind of like pushing a boulder up a hill sometimes. That's how I like to see it.
Yes,
So,
yes. I love that. I love that analogy, and, I mean, the vagus nerve is definitely having its moment now. I mean, many people have at least heard of the vagus nerve and associate the vagus nerve with mind-body work, with calm, that rest and digest state, which absolutely 100% we need to associate that. It's so important for kids' health again, I have a whole chapter on it, right, on the vagus nerve. Um and it's called Breathe, because if we can teach our kids to regulate their nervous system and optimize their vagus nerve function, so many, just like the microbiome. I mean, there's 2 things, microbiome, resilient microbiome, resilient nervous system. You
mhm.
really and truly will set your kids up for thriving for the rest of their lives. And when I talk about the vagus nerve, what I tell kids and parents, because unfortunately, as individuals and patients and as practitioners, oftentimes when we talk about mind body medicine, the vagus nerve, it becomes this, "Oh, yeah, I'll do it when I have time. First thing I'm gonna focus on the supplements." Right?
Yeah.
Right, and really, it should be the vagus nerve that we're optimizing. So I let them know, "Look, the vagus nerve, when you work on your vagus nerve with all of these breathing techniques, mindfulness, whatever it is, even devices that can stimulate your vagus nerve, guess what? You will feel calm and good and, in the zone, focused, but that is a really awesome side effect. The real reason to work on your vagus nerve is because it reduces chronic inflammation. It helps regulate your blood sugar. It balances your hormones. It helps your metabolism. It helps you recover from illnesses. And really importantly, it helps optimize your gut microbiome, diversity and function, independent of diet. Now that's a study in kids. That is
Oh,
fascinating, right?
very
Because
fascinating.
and I'm not saying that you can eat an ultra processed diet and meditate your way to a healthier microbiome. No, you need to work on both. But if your kids are one of the many, many, many kids, the 1 in 2 kids that every day on any given day doesn't eat a single vegetable, well, then don't start with that first, right? Start with working on the vagus nerve, laughing every day, walking in nature, mindfully, really doing your belly breaths throughout the day, and that is going to make a difference. So we really need to put, the vagus nerve and prescriptions for exercising our vagus nerve as our top prescription. Much more important than any supplement we're going to take. And say, food is information. Your vagus nerve is information.
Yeah, absolutely. It's amazing when you can start to calm your nervous system. It will transform your life. It's so I sit back and as I'm hearing you say all this, and like I know a lot of this, I teach a lot of this, and it feels like everything around us, for the most part, is working against that,
Yeah.
right? The
Yep.
phones, the bright lights. I think about kids in school, and I know a lot about light because I've had dealt with mold toxicity in the past, and I know how like
Yeah.
sensitive it can make us to lighting. And a lot of people have more sensitivity to lights, and that lighting can affect kids' ability to focus and
Mhm.
just all of that thing. Like lighting matters and our environment around us matters. And so I just sit back and think, like,
Yeah.
wow, how many things are working against not only us as adults, but especially kids and teens in their environments. And so it's like all of those things kind of keep pushing against, like, okay, how can we help our kids? So do you have advice on
Yeah.
like besides like saying, hey, put the phones away? We've had some really strict rules. My kids have gotten older around phones. They seem to have worked fairly well because I don't just see my kids just on their
Just on every
phones.
second. Yeah,
Yep.
yeah. But that is the reality for many tweens and teens, right?
Yes.
Um, and so, I always think that the more we inform and educate our kids, the less nagging we have to do, and they may still not make the choices that we want them to make, but at least they're making informed choices. I mean, let's face it, even as adults, we don't always make the choices we want ourselves to make, right? I mean, how many times do we stay up way too late just getting caught up in scrolling through something, right? And you're like, "Oh my gosh,
Yeah.
I should have been in bed like an hour ago,"
Yeah.
right? And so, we have to just acknowledge that these things in the world were created to be addictive and created to want us to have more and more and more, right? And so,
Mhm.
um, it's just something that we need to be aware of and really educate our kids about, because when we think about, what do teens want and tweens want? They want independence. They want to be in control of their decisions. But when I explain to them, look, the video game makers, the food makers, you bet they're pouring millions of dollars into creating the video game, whatever frequencies and animation and action, and the food flavors, mouthfeel, whatever it is, so that it lights up your addiction centers and you want more and more and more. So you are no longer in control of wanting to play that video game with your friends or wanting that, sugary artificial dyed thing. And so if you want to take your control back, first you have to understand the hold that this is having on you. So now, when we're in this perpetual kind of sympathetic nervous system fight or flight state, we often don't even recognize it because it's just such a common, we're just in it all the time, right? And some people have had that experience. I know I have, where, I've been, I just remember Glacier Park in Montana one time, and, we were there for a week, and it was stunning nature sounds, I mean, just beautiful, and the only way I knew that I actually lived with a constant knot in my stomach is because as we were driving back home, crossing Nevada and heading back home, I could feel the knot coming back, and I realized, "Oh my gosh, I didn't." First of all, I never even knew that was there. Second of all, I didn't realize, right, that I was, that I could live a life that didn't have that, right?
Mhm.
And so recognizing what puts us into that fight or flight, we're late for school, or a friend texts us something mean, or, parents fighting, or whatever it is, right? And then knowing, okay, in those moments, if we can learn how to really use our diaphragm and belly breathe, 10 slow breaths, get us back into a calmer state, that's going to engage our vagus nerve. We have to do that throughout the day. That is why, breathe is one of the five things that we do every single day. But if we learn how to mindfully do them in a way that supports our microbiome and supports our vagus nerve and immune resilience, it's not an extra thing you have to do. You have to breathe every day anyway. But if we learn how to breathe with our diaphragm, we just automatically get into that vagus nerve state. So that's where I want kids to learn how to do that, even when they're on their video game, right? Even if they're kind of amped up because they saw something on social media, just immediately stop. Okay, you feel that, notice that. Now take your belly breaths, get back into that vagus nerve state, and then move on.
Yeah. I think also, and please add to this, I think being outside and in nature and getting that natural sunlight is also an absolute key thing for kids. They don't get enough of that. I notice it with my kids. I'm like, when they get home from school and it's a nice day, I'm like, get outside. Like,
Yes.
get outside. I don't care what you do. You can sit outside and read a book. I mean, I'd rather have you moving, but I don't really care. You just need to be outside, like, by the trees in the sun, because that I feel like can help us calm and get into that vagus nerve, calm our nervous system. It's the complete opposite of everything else for,
Yeah.
all that overstimulation that
Well,
we're
even
exposed
for our
to.
kids, with attention and focus issues, maybe they've already been diagnosed with ADHD, or our kids and teens with depression or anxiety, there are studies showing that just being
Mm.
in nature, right? Like exercise in nature is therapeutic, can
Yes.
work better than antidepressant, anti-anxiety medications, right?
Yeah.
And with no side effects, right? So
Right.
why wouldn't you want that? If we understand the benefits to our vagus nerve and our microbiome, we understand,
Mhm.
oh, that's why. It is a priority. And if you don't, I mean, it's fascinating. Even if you don't have nature, one practitioner was telling me that there was a study, I need to find it, that even just looking at a picture of nature
I
can
have heard
have those
that.
benefits,
Yes.
right? Because think about it, when you're stressed and you just watch a video of a waterfall or the ocean waves or a beautiful, rainforest, you're like, there's just
Yeah.
something, that calms. So,
Yeah.
and exercise for many, many kids with ADHD is therapeutic. It will help their ADHD symptoms. And so, that movement is something we're not doing when we're on our screens. So we always have
Yeah.
to think, what are you not doing when you're on your screen, and make sure that screen time doesn't replace those activities, that we still do those. And then we
Mhm.
do screen time, when we have time.
Yeah, absolutely. So well said. Yes, see my wonderful fake plant here. I mean, I have trees all the way outside my house, but and I don't know what study it is either, but it's come up in conversations with other people, like having even fake plants in your house, even if you can't
Yes,
have real
yes.
plants,
Yes,
having fake plants. It's just that it exudes that feeling of like, oh, I have a little bit of nature around me. Anyway, I think
yeah,
that's so fascinating. Um, okay, I kind of want to finish with a little bit more conversation on anxiety
yeah,
specifically, because we know it affects, like, I don't know what the stats are. Is it 50? It's probably more than 50% of kids at this point. I mean, I
yeah,
feel like
yeah. I mean,
it's like the new where we don't talk about stress anymore. We talk about anxiety. It's all
it's
about
true. It's
anxiety.
true. It is. There's so much anxiety, and so much so that many tweens and teens, they just expect that anxiety is a part of life, right? And anxiousness that's a feeling, right? We all
Right.
get anxious at times, right? But having an anxiety disorder is not something that we should expect to have. So, and there's so many things that go into this, but it is really important, because by the time kids are 18, I mean, 1 and 2 is going to have a mental health diagnosis. And our teenage girls, 1 in 3 teenage girls has seriously thought of suicide. I mean,
Oh, one in
that's
three.
1 in 3. 1 in 3 has seriously thought of it,
Wow.
right? These are the latest statistics. I think about my daughter who's 14 and a half, and I mean, you just have to be present to that reality, right? 1 in 4 teenage girls in the latest study actually had a plan, right? And that's like, I mean, if you're
Wow.
in your teenage girls or boys, gaggle of friends, that maybe there's 10 friends, you look around, likely one of them or two of them is in that situation. So
That's
we as
beyond shocking.
yeah,
Beyond
we as
shocking.
parents and practitioners, we need to be aware of this. We need to understand what can be done, to mitigate this. We need to understand if our kids are in this situation, how do we help? And there's so much from that functional medicine, microbiome, root cause standpoint that we have in our power to do.
Mhm. Yeah. So, okay, here's another question with this. We haven't talked a lot about specific foods, but I do have a question for you about gluten. Do you try to get most kids off of gluten, especially if they've got
Mm.
some health thing? Because for so many people, it does add to inflammation. It contributes to leaky gut, things like that.
That is such a great question, right? Because that's going to be one of the hardest things for teenagers to think about. Um, and if your child has something chronic going on, then yes, I do think that gluten is important as a trial anyway of a complete elimination. The gluten protein and even, the casein protein and the soy protein have been found to directly harm the small intestinal lining. What does that mean? Directly cause leaky gut even for children and adults who don't have celiac disease. And we know that, of course, leaky gut can manifest in all sorts of non-gut symptoms, and mental health and neurologic symptoms are a very common way of presenting. But same thing with any immune condition going on. And so, yes, I have that conversation. And if kids are not there yet, I still have that conversation. We need to try it at some point, right?
Yeah.
But when your kids are really anxious and there's one more thing that you're asking them to do, and another thing that makes them stand out from their friends, I don't want to cause added stress. But it's just an information. Look, this is let's talk about the microbiome, talk about where your neurotransmitters are from, where we want to get you, what your goals are. Gluten isn't helping, so we're going to need
Mhm.
to try that off at some point, but let's do some other things first, right?
Yeah.
Some kids are gung ho. They're like, "Okay, I'll try it. I'll do." So I never want to assume, right?
Right.
I've had some kids where it's like, "Yeah, well, mom's already not having gluten, so fine. That's easy."
Yeah.
Or right? Or, I don't, eat a lot of gluten stuff anyway, although you might be surprised, right, when they really think about it. But so I let them know the importance of at least trying, right? Because sometimes that is one of the pieces that's missing. But then with that, when we think about the gluten in kids' diets, oftentimes it's mixed in with, a load of ultra processed foods. So simply
Yeah.
just maybe not focusing on the gluten, but focusing on getting rid of the what I call the microbiome mischief makers, but all of those ultra processed FDA food additives that are, wreaking havoc on your child's gut microbiome and their brains. Maybe that's the first swap. Maybe the first switch is just recognizing that, that mocha frappuccino that they're having every day after school, with emulsifiers and, 52 grams of added sugar when they should be having no more than 25. All right, let's work on that. Let's make a
Yeah.
swap. Let's figure out how do we change that up. So, I like to see where kids are at, but yes, I mean gluten is an important conversation.
Yeah, I think you're right. Like once you've stripped down a lot of the additives, processed stuff, then you start looking at, okay, if we're eating whole foods and we're still eating gluten and we still are having symptoms, I've seen massive wonders with improvement in anxiety. And
Yeah.
I find it the hardest when, especially with kids and even adults, trying to get them off of gluten when they don't have a specific digestive problem from it, but it is more neurological. They're like, well, but I don't have my belly feels fine. And I'm like, okay, yeah,
Yeah.
but it's affecting you neurologically. And I just find people have a harder time wrapping their head around it. And
Yeah.
you just gotta sometimes eventually get to a point where you get it out, see how your kiddo is feeling without it. And then when they do eat it again and see how their behavior changes. Like
Yeah.
I've seen such massive transformations. I get very passionate about it, especially with kids and health stuff because I've seen the magic that it can be. But again, you got to strip out the really processed stuff first.
Yeah. Well,
Um,
and that to your point, because it can be really hard for kids and adults to think about why are we talking about the gut microbiome when my kid has anxiety or they have eczema. So, part two of my book, it's literally called, But There's Nothing Wrong with My Kid's Gut, because that is, a
yeah.
common, like, why are we doing a stool test? They don't have constipation or diarrhea. And so, understanding the why,
Mhm.
then makes all the other things like, why is she asking me to go off gluten, or change X, Y, or Z, or taking gut health supplements? And that's the why. We have to understand the why, why the microbiome is so important.
Yeah, I love that you are so all about educating your patients. I think that's huge. And I've seen that with my kids too. When you educate them about certain things, then they have the power, especially as they get
Yeah.
older and they start getting into that preteen and teen. You educate them, then they start to make their own choices. Then when they make poor choices after making good choices, they start to realize the ramifications and they kind of end up just they'll end up self-taking themselves off of gluten
Yes.
or dairy or
Yes.
whatever it is.
Yeah.
Yeah, so I love
Yeah.
these conversations. I think they're so powerful. I love educating parents and getting it into your kids. So, Dr. Elise Song, this is amazing. Appreciate all the work you do so much. Is there any last thing I want to ask you that you want to share with everybody that we haven't yet covered today that you want to leave everyone listening with? And of course, we'll put links below where everyone can find your book because you guys, this is definitely going to be a book that I'm like, on that bedside table. This is going to be
Yeah.
a reference guide. I love, 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 love that you put so much amazing work into this. So
Thank
thank
you.
you.
So, I know that we have parents, mamas listening here with kids of all different ages and stages. And, I think as you look ahead to the teen tween post, graduation years where they've kind of you will be an empty nester at some point, right? And so, just really trust that the educational foundations you're laying down, whether they're infants and toddlers and you're speaking to them about their poop, or whether they're older and you're doing a deeper dive into the gut brain connection, it all matters. I've seen it time and again, where you will have your teens and tweens frustrate you because you're like, no, but you know better. That's okay. That is what teen and tween years are about. But you lay the foundations, and I see kids, like you said, coming back to it as young adults, and even as parents of their own. So it will happen. This is why we do this, right? Not to nag, but to educate and empower. And you will see the benefits later on.
So good. So well said. Thank you so much, Dr. Lee Song. So appreciate you. And like I said, ladies, we'll put the link below in the show notes to find your book. Do you want to just say your website? So for those listening, if they
Yes,
wanted
yeah.
to go to it right now.
Yeah. So my website is healthykidshappykids.com. You can find more information about the book specifically at healthykidshappykids.com/book. And then I'm most active on Instagram if you want to see me over there. That's healthykids_happykids.
Love it.
And
Love all
guys,
the
I'm
work.
not,
Oh,
as a mom, I don't, Erica can tell you, I don't post fluff. Like I know for me, like I just want to see either something that's going to make me smile and laugh because that's totally, worth your time to stop, or something that I'm like, wow, this was good information. So I always, whatever I post or share or newsletters or I write, I always think, as a busy mom, is this something that is worth taking time out of all the things we have to do? So I'm mindful of us mamas out there.
we appreciate you so much. So thank you for all the work that you do.
Oh, thank you for having me.